Welcome to the Documentation Timelines for Case Managers training. This training reviews critical timelines for the completion of various documents required in providing case management services. In addition to this video, the training also includes the FARS and CFARS user manuals and a handy grid showing when documents are due. These handouts are attached in the lesson media section of this lesson. Additionally, after completing this training, you are required to complete the attached quiz with a passing score of at least 70% to successfully complete this lesson. This presentation will be looking at key documents that are used in the case management services and the required timelines for the completion of those documents, including assessments, service plans, discharge summaries, outcomes, and FARS and CFARS. We'll start with the assessments. Every person who participates in case management services must have an assessment completed. This assessment is the underlying document for all of the case management services that are provided, including the service plan. There are a couple of lessons in this curriculum that are specific to the assessment process, specifically strength-based assessment and conducting ongoing assessments. One of the key elements of the assessment is abbreviated SNAP, which means the assessment should consider the participant's strengths, needs, abilities, and preferences. The assessment should consider the person's functioning in all of the realms of their life, including home, school, work, and community. The assessment is to be completed within the first 30 days of services and must be completed prior to the development of the service plan. The assessment must be updated annually. Different organizations may have different names for the document, but this is the process that assesses multiple areas of the person's life and as well evaluates the safety and well-being of the individual. This assessment should take place in the location where the individual lives. As part of the assessment is to evaluate the safety of the person's residence. If the assessment cannot be completed at the individual's residence, the assessment must be conducted in a face-to-face meeting at another location. Additionally, the case manager must provide justification for why the assessment could not be completed at the person's residence in a note that is placed in the clinical record. This note explaining why the assessment could not be completed at the person's residence must be signed both by the case manager and the case management supervisor. The next document that we're going to talk about is the service plan. There is another presentation in this series that specifically talks about how to write goals and objectives in the service plan and other information regarding an individualized service plan. Regarding the timeline, the service plan is to be completed within 30 days of admission to the program, but only after the completion of the assessment that was described in the previous slides. The service plan should be a living document that changes as things change for the person served. The plan should be reviewed and revised whenever the person's condition, situation, or circumstances change. If not otherwise reviewed and revised, the service plan must be updated at least every 6 months. Documentation for the service plan review must be placed in the clinical record. The next document is the Discharge Summary. The Discharge Summary is usually a specific agency form, whether your organization uses electronic or paper records. The Discharge Summary is to be completed within 7 days of the last date of service The discharge summary is to include several items which are described in this slide. Usually, all of these items are included on the discharge summary form used by your organization, but each case manager needs to make sure that all of the requirements are addressed in the summary. After the completion of the discharge summary, it is to be signed by the case manager and the case management supervisor and then placed in the clinical record. Outcomes are a state-required form that describes both demographic information and information regarding the level of functioning of the person at the point in time that the outcome form is completed. Outcomes are to be completed for both mental health and substance use clients. The state collects this data for two purposes. The first is that it can be used to identify the population served, including demographics, so that the state can identify areas of need within the state, local communities, or individual agencies. The second purpose of the data is to evaluate treatment effectiveness. As our system continues to focus more and more on treatment effectiveness, this data becomes critical for both the state and for the individual agencies. In addition to reporting the information to the state, an analysis of outcome information can assist an agency in providing the effectiveness of treatment and provide that information to any interested stakeholder. In evaluating an organization's effectiveness of services through the use of outcomes, the organization can use this data to identify specific treatment or training needs. By addressing these needs, organizations would hope to improve their effectiveness as measured by the outcomes. The data on the effectiveness of services can be drilled down to the individual provider. Each case manager can follow their outcome data from admission through services and at discharge to assess whether the individuals that we are serving are responding to the services that we're providing, and whether these individuals are improving their level of functioning in the domains that the outcomes measure. Finally, one specific outcome needs to be highlighted, and that is employment status. Research has consistently shown that employment status is strongly related to positive outcomes, specifically maintaining sobriety and avoiding incarceration or commitment to state hospitals. So who is responsible to submit outcome data to the state? For us, outcome data is completed by the case managers, and we should be submitting this data for all individuals who receive mental health and substance use services that are funded by either Medicaid or by the local managing entity. So basically, we submit outcome data on all of the people who receive our services whose services are funded by any public entity or the government. The timing for the completion of the outcomes data differs whether the person is receiving mental health or substance use services. For individuals receiving mental health services, outcomes are to be completed at admission, every 3 months, and at discharge. For individuals who are receiving substance use services, outcomes are only completed at admission and discharge. In substance use services, there is not the requirement to complete the outcomes every 3 months as there is in mental health services. Finally, the contract language for providers who contract with local managing entities, payment is only made to the providers when the outcome data has been submitted in a timely fashion. As indicated, outcomes data is to be submitted at admission and discharge, and in mental health services every 3 months. In fact, the outcome data should match the actual dates of admission and discharge that are in the client record. In addition to completing the outcome data, the case manager should also enter a progress note to record the fact into the clinical record that the outcome data has been completed. The progress note should also include a description in the changes in functioning in the domains that the outcome data records. Finally, the outcomes report contains confidential information and should be shared only within the permissions granted under HIPAA and 42 CFR Part 2. The final documents that we want to discuss are the FARS and CFARS documents. These assessments are a way of standardizing and documenting clinical impressions, including cognitive, social, and role functioning, and including evaluation of mental status. The FARS assessment is specifically for adults, and the CFARS assessment is for children. Included with this lesson are copies of the FARS and CFARS manuals. These documents are included in the lesson media section of this lesson. As indicated previously, the FARS assessment is for adults and CFARS for children. These assessments are only completed for individuals who are receiving mental health services. These assessments are to be completed at admission and discharge and every 6 months in between. Finally, these assessments are only for individuals who are funded by the state through agreements with local managing entities. This completes our lesson on documentation timelines. The lesson includes a review of the documents that are attached in the lesson media section of this lesson. Finally, in order to complete this lesson, you must pass the attached quiz with a passing score of at least 70%. Thank you, and good luck with the quiz.